Hello friends, Namaskar. I'm Dr. Rohit Shetty. I represent Cornea Refractive and Dry Eye Clinic at Narayana Nethralaya Hospital. Through this medium, I would like to take you into a small journey of dry eye and what treatment it offers to you. When people say dry eye, the only thing which comes to your mind is my eye dry? It's just not eye being dry, it's about eye being irritated, eye being red, eye being stressful, dark circles around your eyes. You can have more than 100 different symptoms of dry eye, and we always assume dry eye only is loss of tears or eye being not wet. So that is a very old concept. So through this medium, I like to take you into this journey of the whole concept of dry eye and what are the different issues it can create into your eyes and what symptoms it can bring in to make your life uncomfortable. And all the new modern therapies of dry eye will be discussed in this program. When you say dry eye, the first thing which comes and a lot of my patients ask is, Doc, my eyes are watery, but how do you call it as dry eye? When I give them a drop, they say, it's enough water in my eyes. So the word dry eye sometimes is a misnomer. There's various different arms to dry eye. If your eye is dry, but the water what you have is dirty water, then it can irritate your eyes. So that's why you have all the time irritation. That means your eye can still be dry, but whatever little water you have, tears you have, is dirty. Where does this dirty thing come from? Your glands, all these lids have glands and they bring in tears. There's a lacrimal gland, they bring in some amount of component of tears. Tears, even though it looks watery, is mix of 3 different layers. It's got lipid, it's got mucin, it's got aqueous, and each of these 3 layers are mixed in such good quantity so that it doesn't get evaporated. That's the beauty of creation. So when you have one of those layers being not there, it becomes stressful for the other layers. And that is what happens when I say dirty water. And then all the unwanted dirty stuff gets collected and start creating the mess. So what really happens here is, these products irritate your ocular surface, which is your eye and the conjunctiva and all the white part of it, and create a lot of challenges both for yourself and also for treating physicians. So when somebody comes to our clinic, there are basic tests to be done. One is we look at the quality of tears. We look at also something, they put a drop and use a green light to see, blue light to see how fast your tear breaks up. It's a tear film breakup time. They also use imaging to look at what glands are blocked. They call meibomian glands. They bring in a layer called lipid, which is very important. We can look at how these tears have an impact on your surface of your eye. After all this evaluation is done, clinicians like us will like to personalize it. Dry eye is not about giving XYZ drops and asking you come back after 10 days, 15 days, 1 month. That concept is outdated. That we also sometimes look for things in your body, like in your blood, your vitamin D. If you're not exposed to sunlight, your vitamin D dropping changes your dry eye. Your vitamin B12 dropping changes your dry eye. If you have some other disease in your body, like joint pains, rheumatoid arthritis, changes your dry eye. If you have pimples, acne could change your dry eye. So a lot of these factors has to be looked at. So there's specific blood tests sometimes we give you asking for what you need to do. After you do that, everything is come back based on what kind of blood reports, what does it show. We look at your imaging parameters and then we decide whether we need to do something, invasive procedure, or give you some treatment which is drugs or drops. Most of the dry eye today is not just managed with only lubricants. This managed with advanced lubricants, managed with a lot of lid cleaning, heating procedures, which reduces the inflammation. We use cyclosporin drops, which is very useful. They're non-steroidal drops, very useful to reduce the inflammation. But imagine that you're already in an advanced stage and you've tried all this and not doing well. We have an option called Lipiflow, where it is just a massage of the glands for 10 to 12 minutes. It just keeps the glands, I call it spa for the eyes, because it's just like a spa. Because it gives you a lot of heat which takes out all the glands, blocked glands. And remember what the word I said in the beginning, the dirty tears becomes better tears, or better in quality. And that quality of tears stops the irritation and other things. And we also have a treatment where we use some light intensities over your lids, and then you cover your eyes also with a mask, so that it brings in heat, and with something called photomodulation, which takes care of it. Along with all this, we still have to continue with the medications. Also take care of the nutritional components. It is a very different time of dry eye, because now everybody wears masks, and when you have a mask, the dry eye component is completely different. So it's very important not to allow it to just increase to a stage where we have to do some invasive procedures. 90% of dry eye today can be managed without invasive procedures, and 10% of them very simple, non-complicated invasive procedures like Lipiflow, which is to clean the glands, or the eye light or EI, which helps to reduce the inflammation, can be easily and safely done. So I request you not to wait for a very long time till it becomes till the magnitude of problem becomes to a proportion that everybody needs an invasive procedures. Thank you.